The daughter held her father's hand tightly in the emergency room, but he only looked at her with a blank, distant gaze. That look? I've seen it many times before. Just 2 days ago, he was still healthy, laughing and reading the newspaper every morning. He only said one simple sentence. "I don't know why, but my left hand feels a little numb this morning. Probably from sleeping on my side." No one paid attention. And then, the stroke hit. As a doctor who specializes in the brain, I've lost count of how many times I've seen a father who can no longer remember his daughter's name, a mother who can no longer say, "I love you," just because the people around them thought it's probably nothing. I understand that feeling. The feeling of regret knowing there was once a chance to stop the storm, but everyone remained silent. You see, a stroke doesn't always strike like a violent storm. It comes gently like a tingling hand, so gentle that you just think you're tired. But while you're waiting for it to pass, millions of brain cells are slowly dying little by little. If you're over 60 or if you have aging parents, I hope you'll watch this video with both seriousness and love, because not everyone gets a second chance. And sometimes the cost of delay is an entire life spent in silence, dependency, and regret. Welcome to our Health 24H channel, where your health is our top priority. Here we are committed to providing you with reliable, easy to understand, and practical information about all aspects of health and lifestyle. I'm Richard Mile. For over 20 years, I've worked in the field of neurology, dealing every day with injured brains, fading memories, and dreams cut short by stroke. I'm not here to scare you. I don't want you to feel anxious or afraid. I'm here because I believe when you truly understand what your body's trying to say, you'll know how to protect it. And I also believe you are not alone. Many people have thought just like you. They ignored the numb hand, the slurred speech, the brief, dizzy spell, and then just a few days later, they couldn't stand on their own, couldn't eat on their own, couldn't even remember who their loved ones were. So why are such clear signs so often ignored? The answer doesn't lie in the diagnosis. It lies in the human mind. Let me tell you the story of Mr. Walter, a kind, simple man who always believed he was strong as an ox. Until one afternoon, just because he thought it's probably the weather, he rarely got the chance to say goodbye. Walter is 72 years old, a retired carpenter. His hands once confidently built frames, walls, and a life full of pride and independence. After retirement, he still fixed everything around the house, walked his dog every morning, and insisted on carrying the groceries himself. "I'm still quick and steady," he would often say with a gentle smile. One morning while reading the paper, his hand suddenly slipped and dropped the coffee cup. He chuckled quickly, cleaned the floor, and told his wife, "Guess my hand's a bit clumsy from just waking up." A few hours later, while trimming rose bushes in the yard, he felt a slight dizziness. The feeling passed quickly. He told no one. The next morning, he felt a little unsteady getting out of bed. When he spoke, his words slurred for a few seconds. His wife asked worriedly, "Are you okay?" Walter just smiled and replied, "Probably because I haven't had my coffee." That evening, while watching TV, he reached with his right hand for the remote, but his hand didn't move. His face drooped to one side. His words became fragmented, hard to understand. By the time he arrived at the hospital, it was too late. He had just suffered a major stroke. A brain scan showed the damage had started 2 days earlier. The slipping hand, the dizziness, the slurred words were the first warning signs. We call them TIA, transient ischemic attacks, or mini strokes, but in truth, there's nothing mini about them. They're the tremors before the real earthquake, the brain's quiet whisper, "I'm in danger." If Walter had gone to the hospital at the first symptoms, things might have been different. But like so many older adults, he didn't want to bother anyone, didn't want to cause trouble, didn't want to worry his wife. He thought some rest would fix it, but the brain doesn't wait. I held his hand after the surgery. He was awake but couldn't speak. He tried to open his mouth, but no sound came out. His eyes looked at me full of fear and regret, as if silently asking if only I had come sooner. I've heard that question so many times. And the truth is, strokes don't always arrive with sirens or clear warnings. They come silently, gently, normally, easy to overlook. But inside the brain, those fleeting moments are alarm bells. They start softly, then stop completely. At my clinic, I always tell patients one thing: if something makes you feel not right, speak up, even if it's just a little numbness, a little dizziness, or slurred words. Because with a stroke, time isn't just brain cells, it's memory speech, independence, and life. Now let me show you exactly what those signs are. 7 early warning signs that older adults often ignore. Knowing them could save your life or someone you love. There's one thing that always haunts me when I think about stroke cases in the emergency room. It doesn't come as suddenly as people think. It knocks on the door first with very small, very normal signs. But we ignore it because we think it's nothing. In over 20 years of working with older adults, I've realized most people who suffer a stroke once had a chance to prevent it. They just didn't know or didn't believe that their body was warning them. I'm not telling you these signs as a doctor. I'm telling you as someone who has seen too many eyes full of regret, from people who only wish they could go back 3 days. These are the first 7 signs that stroke uses to whisper to you. If you or a loved one experience them, please don't stay silent. Signal 1. Numbness or weakness on one side of the body. You're holding a cup of tea and suddenly your hand lets go without knowing why. Or your leg feels slightly unsteady, losing balance, even though the floor is flat. Don't assume it's just degeneration or sleeping in the wrong position. Numbness, weakness, or loss of control on one side of the body is the brain's first warning signal. 2. Slurred speech, wrong words, or inability to speak. If your loved one suddenly says the wrong word, stutters, or their sentences are jumbled, don't wait for them to rest and shake it off. I once met an elderly man who said, "I remember everything, it's just my mouth won't cooperate." Sadly, the language area of his brain had already been damaged before that. 3. Blurred vision or loss of vision in one eye. Suddenly it feels like there's a thin fog covering one eye. Then a few minutes later it clears up. Many people assume it's just old age and weakening eyes. But eyes don't blur in that way naturally. It could be a part of the brain not getting enough blood. 4. Sudden dizziness or loss of balance. A feeling of sudden spinning even while standing still. Walter, the man I mentioned earlier, only felt a slight dizziness while trimming plants. In reality, a lack of blood flow to the cerebellum can cause dizziness, falls, and even inability to stand. For older adults, one small fall can change an entire life. 5. Sudden, severe, never-before-experienced headache. If you suddenly have a headache, like being struck hard in the back of the head, even if it's never happened before, don't take it lightly. I once met an elderly woman who said it felt like my head was being torn open from behind. She had a subarachnoid hemorrhage, and she survived only because her daughter called emergency services in time. 6. Confusion or disorientation lasting a few minutes. You forget your grandchild's name. You walk into the kitchen and forget what you came to get. You don't recognize the road home. If this happens, suddenly doesn't last long, but keeps repeating, get your brain checked immediately. A stroke can cause temporary cognitive disturbances before fully striking. 7. A vague feeling that something is wrong, even without clear symptoms. I believe in patients' intuition. One elderly man once told me, "I'm not in pain, not dizzy, but I just know something isn't right." Just a few hours later, he had a mild stroke. Fortunately, he went to the doctor early. Your body always knows what's happening inside. You just need to listen to it a little more closely. You might be asking yourself, why do these symptoms appear and then suddenly disappear? Why is it that for just a few minutes you can't speak, then everything returns to normal? And more importantly, is something more dangerous happening inside my body without me knowing it? As a neurologist, I want you to truly understand, not just to recognize these signs, but to act in time and save yourself or your loved one. Because sometimes what we think is fleeting is actually the brain's final warning. To understand that, you need to know what's really happening inside the brain when these transient stroke symptoms appear. Right now, I'm going to explain clearly with a very simple image that may change the way you think about stroke forever. Imagine your brain as a microscopic megacity with over 86 billion neurons every second. Millions of nerve signals are transmitted, controlling every step you take, your heartbeat, your words, memories, and emotions. To maintain this massive activity, the brain consumes up to 20% of the body's total oxygen, even though it makes up only about 2% of your weight. And to do that, the brain's blood vessels must function like superhighways, constantly delivering oxygen and nutrients without interruption. When you experience a transient ischemic attack or TIA, it means a small blood vessel in your brain was temporarily blocked. The most common cause is a small blood clot or microembolus that floats and then gets lodged in a vessel. It's a traffic jam right in the main artery of your brain's city center. Depending on the location of the brain affected by the reduced blood flow, you may experience different symptoms: loss of speech or slurring if the language center is involved, numbness or weakness in limbs if the middle cerebral artery is blocked. Vision disturbances occur if the occipital lobe is affected, or dizziness and imbalance if the cerebellum lacks blood supply. The danger is that the symptoms of a TIA often disappear completely after a few minutes as the clot dissolves on its own. Traffic resumes. The patient breathes a sigh of relief, thinking, maybe I was just tired, and ignores it. But this is the trap. Because a TIA is not the end, it's the warning bell for a major stroke coming very soon. According to the American Stroke Association, 1 in 3 people who experience a TIA will go on to have a real stroke within a year, and over half of those occur within the first 48 hours after the TIA. The World Health Organization also emphasizes TIA is a golden window for intervention diagnosis and preventing a real stroke. This is especially important for older adults when risk factors like high blood pressure, diabetes, atherosclerosis, atrial fibrillation, and lipid disorders often coexist. If these underlying issues are not controlled, plaque buildup continues, the heart creates more clots, blood pressure keeps damaging vessel walls, and the next time it won't be transient. TIA does not cause permanent brain tissue damage, that's the lucky part, but it's also the final opportunity. Many of my patients were diagnosed with TIA after just a few minutes of numbness or vision loss. They received MRI scans, carotid ultrasounds, ECGs, and were then placed on blood thinners in time. They avoided a stroke. They kept their ability to speak, walk, and live independently. But some came too late because they thought it went away on its own, and the next time they couldn't speak again. So if you or your loved one has ever experienced a brief unusual symptom, numbness, speech difficulty, blurred vision that fades, do not treat it as something small. It's a clear warning from the brain. And if you listen and act in time, you might just save yourself. Right after this, I'll show you how to detect a stroke in just 60 seconds with a very simple test that could help you save yourself or someone you love in a critical moment. When a stroke occurs, time is not just gold, time is brain. Every minute during a stroke, nearly 2 million brain cells can die, and just a 3 to 6 hour delay in emergency treatment could lead to permanent brain damage. I know that sounds scary, but the good news is you can absolutely recognize a stroke in just 60 seconds with a simple test I teach every patient and their family members. It's called FAST, used widely by the American Stroke Association and many health systems around the world. FAST stands for F. Face, ask the person to smile. Observe whether both sides of the face move equally. If one side droops, cannot lift, or shows an uneven expression, it's a sign of facial nerve paralysis due to poor blood flow to the brain area controlling facial muscles. I once treated a 71-year-old former teacher who smiled while talking to her husband, but only one corner of her mouth lifted. She thought it was just muscle fatigue. But after performing the FAST test and calling emergency services immediately, she received clot-busting medication within the golden window. 3 days later, her smile was symmetrical again. A-arms, ask the person to raise both arms forward, palms facing up. If one arm is weak or slowly drops, trembles slightly or cannot hold position, it's a sign of mild paralysis or limb weakness caused by reduced blood flow to the brain. This is a very common sign in strokes involving the middle cerebral artery, MCA. Many older adults think it's just arm fatigue, but in reality, this is a highly sensitive test to detect one-sided weakness. Adwas speech. Ask the person to repeat a simple sentence such as, "The weather is beautiful today." If they struggle to speak, forget words cannot express clearly, or mispronounce the language center of the brain, may have been affected. This condition is known as aphasia, one of the most common symptoms of a stroke in the left hemisphere of the brain. I once treated a patient after a stroke who said, "In my head, I know what I want to say, but my mouth won't listen." That sentence has haunted me ever since. Tea time. If you detect any one of the three signs above, do not wait. Do not drive the person yourself. Do not ask your neighbor. Call emergency services immediately. 911, because time is life. The sooner they reach the hospital, the higher the chance of recovery. Statistics show that if a stroke patient receives treatment within the first 3 hours, the golden window, they are 3 times more likely to recover compared to those treated later. FAST is not just a test, it's a life-saving tool. You can teach this to your spouse, your parents, even your grandchildren. You can print and post it on the fridge, your desk, the bathroom door, anywhere. Because early awareness means survival. We've just gone through critical moments recognizing early signs, acting fast, and overcoming a stroke. But the journey doesn't end there. Protecting the brain is not just about surviving a stroke, it's a lifelong process. I've seen many patients come back after a few months with the same condition, but the second time it was worse and recovery was slower. Because they believe that surviving once is enough. The truth is, if you don't take long-term prevention seriously, the next stroke is only a matter of time. That's why I want to share with you the core principles, simple but life-saving, to keep your brain strong, your heart steady, and your life still yours. 1. Strictly control blood pressure, cholesterol, and blood sugar. These are the silent killer trio responsible for over 80% of ischemic strokes. High blood pressure damages vessel walls and promotes blood clot formation. High cholesterol builds up into plaques that narrow the arteries. Diabetes reduces vessel elasticity and increases the risk of inflammation. What's worrying is that many older adults don't even know they have all three because there are no clear symptoms. Only when the arm goes numb, the words won't come out, they rush to the hospital. But by then, the brain has no more time left. Measure your blood pressure at home at least 2-3 times a week. Test your blood sugar and cholesterol every 3-6 months, especially if you're over 60. If you're prescribed medication, take it on time at the right dose and never stop without medical advice. 2. Screen for atrial fibrillation. When the heart falls out of rhythm, the brain pays the price. Atrial fibrillation, AFib, is a common type of arrhythmia in older adults, especially after age 65. The heart beats irregularly, blood pools in the heart chambers, forms clots, travels to the brain, causes sudden blockage. The danger is that AFib often has no clear symptoms or only shows up as unusually fast heartbeat, palpitations, fatigue, shortness of breath, sometimes just a fluttering feeling in the chest. If you've ever felt that, see a doctor for an ECG or 24-hour Holter monitor. If detected early, blood thinners or heart rhythm control can reduce stroke risk by over 60%. 3. Preventive lifestyle. Low-salt diet, daily walking. Take medication on time. Don't wait until complications appear to make a change. Stroke doesn't wait for us to be ready. You can start today with small actions that make a big difference. Low-salt diet. Reducing salt helps lower blood pressure. WHO recommends under 5 g of salt per day. Walk 30 minutes daily, improves brain circulation, reduces excess fat, stabilizes blood sugar. Take medication on time. Set a fixed schedule. Use a pill organizer or phone reminders. Health is a habit, not a miracle, and only you can decide how you will maintain it. 4. Routine checkups, and the key to protecting your brain after 60. After 60, the body no longer sends clear alarm bells. many changes happen silently. Blood vessels stiffen and response slows down. Heart rate becomes more irregular. The nervous system loses flexibility. So see a neurologist or cardiologist at least every 6 months. Track your results, blood pressure, HbA1c, cholesterol C, and atherosclerotic ultrasound. And especially note down any unusual symptoms, even if they're brief. Stroke prevention is not about fearing the future, it's about protecting the present. Because you deserve many more healthy years with your family. Because an afternoon walk or a family dinner may be the greatest gift health can offer. You know, I've seen too many patients collapse because they didn't think a few minutes of numbness in the hand could be a warning sign of stroke. They didn't call emergency in time, didn't get to say goodbye, and left behind in their loved one's eyes a regret no medicine could heal. So today, I'm not here just to talk about a test, a symptom, or a statistic. I'm here to remind you that life, though fragile, is deeply worth protecting. If you've ever felt fear, felt yourself growing weaker, or heard a quiet warning in your heart, I want you to know you're not alone, and it's not too late. There's still time to make a change. A walk in the morning, a timely blood pressure check, a call to check on your parents today. The thing that preserves your clarity, your smile, your voice for you and for the ones you love. Please don't keep this knowledge to yourself. Share this video with your loved ones, your friends, and anyone who needs a timely reminder. Hit the subscribe button so we can meet again in videos that may one day save your life. I'm Dr. Richard Mile. In over 20 years of working with the brain, I've learned one thing. Taking care of your health is not just science, it is love. And today I send that love to you through everything I know and everything I believe. Wishing you strength, clarity, and the fullness of every moment. Because you deserve a life that is whole, safe, and full of energy even as you grow older.